So you guys, I came across these videos that I also felt the need to talk about. It's about the Okoyemi's weight loss thing going on, right? So there were like a few misconceptions about the healthcare system that I felt the need to also, you know, give my few cents, right? Okay, so let's watch this clip right here.
How many of you have listened to Okoyemi's video? How many of you have listened to his video on his weight loss journey? The doctors, many of them know the truth that we are the people that will help you heal from sicknesses. But because they want to sell their medications to you, they will never tell you the truth. Okoyemi started suffering from diabetes, high cholesterol, and other health issues. He went to his doctor. Do you know what the doctor told him? Do you know what the doctor told him? The doctor told him to go and lose weight. The doctor told him to go and lose weight. Okoyemi started losing weight. He started doing OMAD, 1 meal a day. His doctor never placed him on medication. His doctor never gave him drip. His doctor never gave him anything because he is his friend. The doctor knows the damage of those medications. And the doctor knows that the medication will never heal him from diabetes and high cholesterol.
That guy didn't know, but Okoyemi said he was pre-diabetic. Now there's a difference between pre-diabetes and actually being diabetic, right? Pre-diabetes is basically when your blood sugar is high, but not high enough to be called diabetes. Then diabetes mellitus is when your blood sugar is consistently high, very high that it has crossed the diagnostic threshold. That's diabetes, and that is the major difference. And most cases of pre-diabetes is usually reversible. Maybe he didn't actually get that part, he just had diabetes. And then now I don't have a problem with what he was trying to say, right? I feel like I get his point actually. Sometimes you can have a good point, but you don't know how to like make it make sense to people. I actually understand what he's trying to say. Of course, we cannot excuse the fact that it's okay to go to the gym, to stay healthy and all of that, because he's a fitness instructor, right? I'm not disputing that fact. That the idea he had in his head makes a lot of sense, but the way he put it, the way he was consistently and constantly trying to remove doctors from the equation was what actually triggered me. Because if you watch the video to the end, like if you probably go to his page and look for the video and watch it to like the end, you would hear where he said that, oh, that doctors know that they are the ones that cure people. That if a doctor gives you medications for any kind of illness, that they don't like you, that they're trying to extort you, bro, be for real. Be for real. What are you trying to say? What are Like I said earlier, being pre-diabetic doesn't exactly mean you are diabetic. Most cases of pre-diabetes is usually reversible, right? I understand what he was trying to say. Like I said, I get his point. It's in his head, but like he doesn't know how to make it make sense. Now, if there's something I know for the most part of me being a medical student, is that there are different lines of approaches to different illnesses, right? If somebody presents to you with a particular illness or a condition, there is always a first line of action that may or may not involve medications. For instance, in the case of Opeyemi being pre-diabetic, right? It is not rocket science for his doctor to tell him that, okay, first off, you need to start by losing weight, getting some dietary regulations, cutting down on junks, eating healthy, losing weight, hitting the gym. It is not rocket science. That is the first line of action for most cases of prediabetes. That is the first thing any doctor would tell you. So them saying that, okay, that they did not give them medications the first time. You are not a doctor. You probably don't know, right? So them telling Opeyemi like to hit the gym to lose weight, it is not rocket science. It's basic knowledge. It's basic knowledge. It's the same thing as when somebody presents to the hospital or to a doctor with constipation. Nobody is going to give you medication as the first line of action or the first line of treatment. First off, they would ask about your diet. What have you been eating? What did you eat? Okay, you know what? Take a lot of water, take enough fiber, take enough fruits. That's how it works. It's basic knowledge. It's not rocket science. But you probably didn't know. You probably didn't know. And then I don't have a problem with you not knowing. It's the fact that you're trying to put doctors and what they stand for under the boss. What do you mean somebody goes to medical school? Like I am a medical student, I go to medical school. After all of this, all of this chaos I am in right now, I finally graduate, get my license, only for me to come out and I'm hearing that okay, it is gym instructors now that they are the ones that are healing and treating people. That if a doctor prescribes medication for you for any type of illness, then they have done something very wrong. My brother, you might as well want to carry out a mastectomy with some dumbbells. I don't know. You want to do that? You want to try that? Now, I'm also going to attach Wemi's video to this video because I couldn't stitch it because he also said something that I don't agree with. Now, let's watch this.
Okoyemi, how did you lose drastic weight? I think I get at least 50 of those DMs every day on our platform. So I'm going to tell you how I lost weight. And I'll show you a screenshot on this page. And this screenshot is a post I did in September last year. And in the video last year, I began the video with how I am losing weight. And in the video that I posted September, I began with 11 weeks ago, I started my weight loss journey. So meaning in September last year, in the video intro, I mentioned that 11 weeks ago, I started, that was May, if I'm correct. May or March, I started my weight loss journey. And I gave the reason that before then, I have been trying to lose weight and I have been failing. But I took my weight loss journey serious the day and a friend went drinking in Yaba. And for 3 days, I had a migraine and I had heart palpitations. And I went to the doctor and we did a full body check. And the doctor told me that your cholesterol is high, you are pre-diabetic, and you have high blood pressure. The doctor is my friend. The doctor is my guy. And the doctor knows that Okwe don't touch money. And he said, Okoyemi, you've touched money. If you don't want to die at age 50, lose weight. That all the health problems you have, fatty liver and all, if you lose weight, all your health problems, 99% of them will go away. And if you don't lose weight, as a doctor in Nigeria, when people like you come, we are trained to give them medicine that will sustain them for life so that they can keep on coming back to us. Meaning I'll be giving you pills to manage your blood pressure, to manage your cholesterol, but you will not be cured. That is what they are trained to do. That is what he's supposed to do to me as his patient. And that's what they do to the other patients who have high blood pressure, high cholesterol, this. Just give them drugs to just bring it down small.
Okay, so before I continue this video, this is not me making excuses for the bad doctors out there. This is not me making excuses for the doctors who are so money conscious that they would intentionally want to extort people and not give them the right medications, or in cases where they are supposed to do something else, they are doing another thing just to extort the patient. No, I'm also not excusing the fact that there are people like that in our society. Of course, we are all human beings. Everybody's not going to be perfect. There certainly would be bad eggs. So I'm not trying to say that okay, that it doesn't happen, right? But see where I have a problem with what he said. First off, he said that his doctor friend told him that in Nigeria, that is how they train. That was him generalizing. I am a medical student currently undergoing training, right? I am schooling in Nigeria. I am training in Nigeria. And that is not how I am trained. That is not how we are trained. At least for some of us, I have seen, I have known, I have been with a lot of doctors. Not for once have I heard or have I seen a doctor, try to give a patient or try to give somebody the wrong medication because they want them to continue coming back. I'm not saying it doesn't happen. Of course it does. It definitely will be happening somewhere, right? But saying that is how we train in Nigeria, bro, don't do that. Don't do you- There are a ton of good doctors out here in Nigeria. For the most part, doctors in Nigeria are not they've been complaining that they're not even, these are people that are not being paid well. These are people who once in a while go on strikes because they want to get the attention of the government, to like do better in terms of um money. These are doctors who once in a while go on strikes because they want to get the attention of the government to do better in terms of paying them well. These people are literally overworking and getting underpaid. So this narrative flying around now, I'm not sure it's going to help the situation. If your doctor friend, or if you feel your doctor friend told you that because he could not extort you because of the kind of friendship you both have, then if that is what he does, then I don't think he's entirely a good person. That means he's doing it to other people. If that is what he does, if that is what it means, that means he's doing it to other people. That means him as a person, he also does it, do it to people. And he just didn't do it to you because you're his friend. It says so much about the kind of person he is. The fact that you people are not medical doctors, and then you think you know too much about the healthcare profession to have these kind of opinions, it's sickening to me, honestly, because medicine is a whole 6 years plus an extra year for house job, that's 7, an extra year for NYSC, that's 8. So people give 8 years of their lives, go to med school, do all of this, get your license, be a doctor. For you people to just sit in your houses and make assumptions, it's not nice at all. In your case, Opeyemi, yes, a doctor can actually give medication as a first line of action in pre-diabetes. That is why he is a doctor. After a good examination, there be extreme cases where he would have to administer drugs first. Say in case of an obese person, that's why he's a doctor. After a good examination, he knows what to do. And if you think your doctor is not getting it right, or if you feel he's extorting you, it's okay to take it up with him, right? Take it up with him. You have the right. As a patient, you have your right, the right to know the kind of drugs you're giving, the right, you have the right to any information you want to know, because you're the patient, you're the person that is going to receive and get all these things. You are the receiving end, so you have the right to know what's actually going into your body. Ask questions, right? Not make assumptions. I fuck with Miss content. I still do. I feel like I just love his boldness. I love the fact that maybe he's just himself, right? So, but like, I just don't agree with this one. This particular one, I don't agree with it. So yeah, this is just my opinion, anyways. Peace.